My name is Dr. Lieschen Quiroz, and I'm a professor of obstetrics and gynecology at the University of Oklahoma Health Sciences Center, and I'm the section chief for female pelvic medicine and reconstructive surgery, or urogynecology. So I always knew I wanted to do and focus on women's health. And in this specific field of women's health, I treat women beyond the childbearing years. So I treat women who are encountering problems later on in life, usually when they start having problems such as pelvic floor disorders, pelvic organ prolapse, urinary incontinence, and so on. And so a lot of these women tend to encounter these problems and they don't necessarily bring it up because of issues with embarrassment. And so I'm here to provide these services in a subset of women that may not be otherwise seeking care. So it's important to raise awareness of these problems to as many women as possible, for them to know that there are subspecialists such as myself here to provide this kind of service for them. In general, I always knew I wanted to pursue medicine because I knew I was drawn to helping people. And I knew that early on that I wanted to emulate much of what I saw in my family physician growing up, and it was something that I got inspired to do early on. I felt like the right fit for me as I emulated and as I got exposed to people in the medical field. And as I sought out the mentoring aspect of it, I also saw it as a good fit for me as well. I'm the first doctor in my family, and so I didn't necessarily have that as an exposure. However, I had that as a goal, and when I sought it out, I saw that it was going to be the right fit for me. So that's a good question, because I think that there's a lot of planning that needs to go into going into a medical career. I think that one of the best things is to seek advice early on and try to find a good mentor or a good advisor early on. The other aspect that I think I need to point out to you is that there is this tendency to focus on the length of years that it takes to dedicate to the career in medicine. However, there is so much gained along the way in each and every step of your training. So I think part of it is the journey and how you grow in your career. That is very inspirational, even when I learn from other colleagues of how they got to where they need to be. So more than focusing on the length of training, it's important to know that the goal is to eventually be the physician that you're meant to be, but to enjoy the actual journey is an important part of it. Lastly, I think that there is a focus lately as to these buzzwords that are, you're hearing out, such as physician burnout and so on and so forth, and this focus on wellness that needs to be out there. And I want people who are thinking about this career to ask other people who are doing it successfully, to ask how they're doing it, because there are lots of us that are enjoying our lives and enjoying taking care of our patients, and we have, some of us, found this way to do it and a way to do it successfully. And I feel like it's important to have, some of us advise people who are considering this career as tips and tricks of the trade and life advice overall. So I think it's important for overall raising awareness of the kinds of conditions that I treat. And there are lots of women out there who are at this point thinking about it. And when I'm mentioning things like urinary incontinence or relaxation with pelvic floor and so on and so forth, that they have been thinking that they have a problem, they're not quite comfortable bringing it up because they think that it may have to make a decision for surgery. I want lots of women out there to talk to their friends, talk to their family, advise their friends to seek help and to seek medical attention, because there are lots of non-surgical options that we can provide for them that can be, in a lot of times, as they tell me, life-changing. And so there's lots of different ways that we can help them, and if anything, help rehabilitate them to get them to a better quality of life overall.